Hello, everyone. Welcome. Thanks for joining us. As always, we're going to give it a few minutes to let folks get logged on. Good to have you with us. Morning, everyone. Thanks for joining. We're going to give folks a few minutes to get logged on. We have a number of people registered. If you're one of those friendly types and you want to introduce yourself and say hello in the chat, please feel free to do so. Good morning, everyone. Thanks for introducing yourselves in the chat. Always exciting to see statewide presence showing up here. I saw Eagle County, Colorado Springs, Pueblo, Westminster, Montezuma County, folks in Denver, Telluride. That's awesome. Thank you for being here. I'm going to give us one more minute before we dive in. Please keep introducing yourselves in the chat. We'll give it one more minute. All right, well, let's go ahead and get started. Hey, everyone, my name is Jace. I work at the Colorado Health Foundation, and I have the great privilege of leading our public opinion research projects, including Pulse, the Colorado Health Foundation poll. I'm excited to have a good group of folks with us for a conversation. I'm going to start with some housekeeping. Dave is advancing our slides, so Dave, go ahead and go to the next one. Thank you. So for housekeeping, you're muted, your camera is off. You probably realized that already, but we still want to hear from you. So please use the chat, introduce yourselves, ask questions, share your insights and your thoughts. Always love to have a robust conversation going in the chat. And a couple of my colleagues are in the chat, able to answer questions, help with technical issues, really engage with folks. So please, let's use the chat for that. Closed captioning, I believe it is available. We're trying to make it happen. It seems to be giving us a little bit of trouble. If you need closed captioning, feel free to put that in the chat, send it to hosts and panelists, and we'll do our best to work one-on-one with folks since we're having a few technical difficulties. Also, a note that we are recording and we will make this recording available after the fact. The slides will be available too. This is your chance to plug in real time, and then we'll make sure you can come back and dig in afterwards. So let's go next. I'm going to start by telling you about the Colorado Health Foundation and who we are. Our work is really about bringing health and reach for all Coloradans, and we focus on those for whom health is the furthest from reach, and that is to say people who live on low income, people of color, people who live in rural Colorado, all key populations for us. We try to make this change and charge toward our mission of improving the health of Coloradans through a number of different tools. We have a lot of different tools in our tool belts. We're most known for our grant making. We invest in communities and with our partners. We also advocate for good policy and really believe in the power of policy to improve the health of Coloradans. And then finally, what we're talking about today is research. We want to understand Coloradans through research, and Pulse is one way among many that we use the tool of research. Next slide, Dave. I'll tell you a little bit about Pulse, although I know some of you are repeat offenders and you've been logging on over the past several weeks to dig into this poll, and you're among my favorite people in the world. Thank you. Pulse is an annual poll that takes the pulse of Coloradans across a range of issues that impact health equity. And we really think of it as a way to listen, to hear from folks outside of our bubble, people who think differently than we do, who live in different parts of the state than we do. And we want to build a greater understanding of how Coloradans are navigating today's challenges. As part of our commitment to racial justice, sorry, Dave kicked me back, thank you. We do a number of oversamples, and Dave and Lori, our polling team, will tell you about these. But we oversample African Americans, Asian Americans, and Pacific Islanders, as well as Native Americans. And specifically for our oversample of Native Americans, we work with a number of partner organizations. You can see on the screen, those folks, organizations and individuals help make the oversample possible. We'll talk more about these oversamples and how we do them in subsequent slides. And of course, if you have questions about the how or the why, please put them in the chat. We love to talk about our oversamples. It's one of the things that I know I'm personally most proud of with regard to this project. Next slide now, Dave. So some of you may know this year we've been releasing Pulse in phases. Pulse is a large survey. It takes about 20 minutes if you were on the phone answering questions. It's like 46 questions. It's almost 3,000 people. So it's a ton of data. And to make it easier to digest, we've been releasing it in phases. So we started with the cost of living and housing. Then we went to health and well-being, where we talked about mental health, healthcare, alcohol and drug use, and now we're releasing it all. Every question, every insight, we're covering everything today. I did want to draw your attention to the fact that there are some pieces of data that are completely new. So if you have been following along and you were a part of phase 1 and phase 2, there's still new stuff for you. So we're going to be talking about Coloradans' perspectives on COVID-19, jobs and the Great Resignation, wildfires and climate change, crime and policing. That is all completely new content. Even if stuff isn't new to you, you'll want to listen in, because I always learn something new when I hear Dave and Lori talk about this data, and I'm sure you will too. And if you're feeling like you've heard something before, just stick around. There's new insights just around the corner. Next slide. So just a glance of how we're going to share the data today. We're going to start with the top concerns of Coloradans. Then we'll talk about cost of living, jump to jobs. Those two things are pretty well connected. We'll talk about housing, healthcare, COVID-19, revisit some of our findings on mental health and well-being, alcohol and drug use, and we'll end with the completely new content on crime and policing. So a pretty robust agenda. We'll collect questions in the chat, and then after we go through the data, we will answer those questions and have some discussion together. So at any point, don't let a question leave you, throw it in the chat and we'll address it. We may address it in the chat, or we'll lift it up and discuss it verbally together. So that's what we have in store for you today. I'm very appreciative of your time and your willingness to come and engage with us on this data. We have two partners in this work. I'm going to turn it over to their incredibly great colleagues and have been incredible working with now for 3 years. This is the third year we've conducted Pulse. It's Dave Metz and Lori Weigel. They're our polling team. Dave and Lori, thanks for being here, and go ahead and take it away.
All right, fantastic. Thank you very much, Jason. Thanks to all of you for joining us today. We're looking forward to walking through what are, I think, a very fascinating set of findings about a range of issues facing Colorado and the attitudes that Coloradans have toward them. But before we dive into the numbers, just a little bit about how we did what we did. The survey was conducted during the month of April over roughly a 3-week period. And we tried to speak to a random and representative sample of adult Coloradans. Our approach to doing that was to draw a random sample of residential addresses drawn from Postal Service files, match those addresses to a variety of databases, which gave us contact information for those addresses, landline phone numbers, wireless phone numbers, and email addresses, and then to reach out to randomly selected adults in those households using those phone numbers, using email and text invitations, and sending postcards to households for which we had no other means of reaching out to them. As Jace noted, we also oversampled a number of key subgroups of the Colorado population that are relatively small shares of the population, but may have distinct perspectives that we wanted to make sure were captured in the data. So that included oversamples of Black and African American Coloradans, Native American and Indigenous Coloradans, and Asian American Coloradans, as well as residents of Pueblo County. We wanted to take a closer look at that geography in the data as well. This process ended up producing nearly 3,000 total interviews with Coloradans. When we got the data back, we weighted it demographically to reflect census data for the adult population of the state. And we conducted interviews in English and Spanish to make sure that that language barrier didn't prevent Coloradans from participating. In addition, we should note that the reason that you have two pollsters on the phone today is that we represent a bipartisan team. And as you'll see when you see my colleague Lori Weigel in a moment, this is one of those days where we have color-coded ourselves. My firm, when we poll in partisan races, only polls for Democrats. Lori's firm only polls for Republicans. And so there we go, blue and red. The reason for that is we wanted to make sure that both the design and analysis of the survey data reflected a bipartisan perspective. Hopefully we have accomplished that. With that, let's go ahead and learn a little bit more about what we found. Oh, one other note before we dive in, you'll see some places where we segment the state geographically. We divided the state into 6 regions, which you'll see detailed here. The counties of the Denver metro area, El Paso and Pueblo counties individually, because again, we oversampled Pueblo County, so we have enough interviews there to say something meaningful and distinct about it. Larimer and Weld counties, and then we have the Western Slope and the Eastern Plains separately. So to start with, big picture, what are the top concerns for Coloradans today? We came at this question in a number of different ways, and the first and most straightforward was simply to ask them, in a few words of your own, what is the most important issue facing Colorado right now? And as you'll see, cost of living issues were really the things that were most frequently mentioned. About 1 in 5 named the cost of living specifically. Another 17% talked about affordable housing, which is obviously a related concern. And you'll see other mentions as you move down the slide about things like taxes, healthcare, which included healthcare costs. So lots of people volunteering the cost of living as a concern, which is distinct from what we've seen in prior years' surveys, where that was certainly a significant concern, but not at the very top of the list. Other items that are frequently mentioned included concerns around water, climate change, and the environment, political divisions and dissatisfaction with the functioning of government in the state, and then growth and a variety of challenges that leads to for Colorado. And just to give you a sense of how people articulated some of these concerns, you'll see some examples here of the way people answered this question in their own words. describing what they viewed as being the most important issue facing Colorado. And again, you'll see a lot of it here is just talking about different aspects of the cost of living and the impacts that has had on Coloradans' lives. Now, as I noted, there has been something of a shift in the concerns that respondents mention in answering this question. One of the virtues of having this series of annual surveys that Jace described is we now have 3 years where we can compare how public opinion has shifted. And it's obviously been an eventful 3 years with everything that has gone on in public health and the economy and politics. And so you'll see, not surprisingly, that the top concerns of Coloradans have shifted over that period of time. At the bottom of the slide, you'll note that the coronavirus, which was the #1 concern in 2020, not surprisingly, has declined significantly. Only 2% of Coloradans today name that as the state's most serious issue. And then conversely, we've seen that increase in concern about the cost of living over the same period of time, basically doubling over the course of the last 2 years. Another way we came at this question was to offer respondents a list of issues rather than having them just name them on their own and rate their level of concern with each one. So we gave the respondents the list of concerns you'll see running down the left-hand side of the slide, had them rate each on a 4-point scale as either an extremely, very, somewhat, or not too serious problem. And the total that rated each either extremely or very serious, the top 2 points of the scale, are running down the right-hand side, and that's how we've ranked them here. This approach to the question doesn't yield very different results. It shows once again how dominant the cost of living concerns are. Cost of living, top of the list, 88% extremely or very serious. Cost of housing, essentially an equal level of concern. And as you move down the slide, you'll see the cost of healthcare also ranks in this top tier as well. Other concerns that at least 2/3 of Coloradans are rating as a very serious problem include wildfires or other natural disasters, homelessness, and then solid majority is also concerned about mental health, drug and alcohol use, and crime. Every single one of these issues is one that we anticipated would be a concern for Coloradans, and so we had more detailed series of questions that explored them, which we'll be walking through as we go through the presentation here. But we also had a lower tier set of concerns, which you'll see on this second slide. And it's not to minimize the number of Coloradans that view each of these as a problem. In fact, there's a majority for every single item that we asked about that rated it at least a somewhat serious problem. But the intensity that we're seeing around issues like hunger or racial bias and discrimination or the spread of new variants of COVID-19 is notably lower than what we saw for those items on the prior slide dealing with the cost of living or with homelessness. One issue that we wanted to take a little bit closer look at this year, and we haven't done so much in prior surveys, is climate change. And here you'll see the numbers that were just on the slide I just showed you, showing that a slim majority of Coloradans rate climate change an extremely or very serious problem, 53%. But what's striking about this issue is not the overall level of concern, but the stark differences within the population in terms of which voters view it as a serious problem. And the biggest one here is political party. Among those respondents who are registered to vote, we asked them what party they're registered with. And as you'll see, there's a huge difference in how they view the issue of climate change. In fact, it is the single issue in our poll where we saw the biggest partisan difference. 82% of Democrats view it as a very serious problem. Republicans only 13%, a gap of nearly 70 points. It is not unique to Colorado. We've seen the same thing in polling all over the country, but it does show an issue where there's just a very deep and stark partisan division in place. Also some notable differences by age. For the youngest Coloradans, those under age 30, it is a much more significant concern than for those older. Also somewhat higher concern, as you'll see here, among voters or people of color in Colorado, particularly Asian American and Pacific Islander Coloradans, than for others. Now, connected to climate change, of course, is the issue of wildfires, which have been an increasing concern in Colorado in recent years as their frequency and severity has increased. And Coloradans recognize this. 68% recognize it as an extremely or very serious problem. That's a significantly larger number than, say, the same for climate change more generally. And to a greater degree, this is an issue that cuts across partisan lines. As you'll see on the lower right-hand side, While there is a partisan gap and concern about this issue, almost half of Republicans do view it as a very serious problem. So it's nowhere near as large as what we see for climate change itself. It's also striking the degree to which concern cuts across geographic areas of the state, both those that are most immediately at risk of wildfires, as well as those, obviously those even in urban areas of the state, impacted by smoke, as well as being at some risk from fires themselves. So there is no real geographic skew in Coloradans' concern about this issue. So stepping back and thinking about the broad range of issues we asked about, again, we can draw some comparisons for year to year in terms of how Coloradans' concerns have evolved. And there are a few places where we have seen some significant changes since last year in the level of concern that Coloradans express. For two issues, there have been double-digit increases in concern. That's the rising cost of living, which you'll see is up 15 points since last year and fully 25 points since we asked about it in 2020. And then crime. There has been a 16-point increase in concern about crime since last year, with almost 3 in 5 Coloradans now viewing it as a very serious problem. Conversely, one issue where we've seen a decrease in concern that is outside the survey's margin of error, and that is racial bias and discrimination, which was in the low 40s in 2020 and 2021, dropped down to the mid 30s this year. Finally, we also wanted to understand, since this is an election year, how these concerns that Coloradans are expressing might map onto some of their voting preferences. And so we asked the respondents to tell us in their own words what issues would be most important to them in selecting a candidate this year. And as you'll see, not surprisingly, it's the same issues about which they expressed concern earlier. The cost of living, inflation, affordable housing, climate change in the environment, healthcare, also jobs in the economy, about 1 in 10 mentioning that concern as well. And again, here you can see some of the things that Coloradans told us in their own words were the issues that they were most concerned about. One of the striking things here, of course, is that it's relatively few Coloradans who are pointing to a single issue that they say is dominating their concerns. It's easy for most of them to come up with a fairly detailed list of a variety of concerns that trouble them. So with that overview of the broad set of issues that are on Coloradans' minds, I'm going to hand it over to Lori now to talk in more detail about the one that really is the dominant concern, which is the cost of living.
Great, thank you. So we just saw some of the massive increase in terms of concern about the cost of living, but that has really come not equally everywhere, although certainly the rising tide has sort of lifted everyone into a greater level of concern. But over the last 2 years, we've seen a real marked increase among some particular subgroups. Notably, and I often get asked this question, especially when it comes to the cost of housing, but we're really seeing the cost of living really resonate and be a concern across geography. So the Western Slope, for example, has seen a 35-point increase, but nowhere in Colorado has been really immune to this. Double-digit levels of increase in terms of concern about the cost of living, whether one is on the Eastern Plains or in the Denver metro area. So really high levels of concern across the board, coming among white respondents as well as among people of color throughout the state. We also saw that we sort of anticipated that this might be an issue. And so with that foresight, we asked people to tell us what specific expenses were most concerning to them. So basically, let's define cost of living and get underneath that a little bit. And they could say anything. So I particularly love the 2% that just said, everything has gone up, and that's the specific expenses that I'm most concerned about. But you can see that really a lot of it does focus on housing. Half volunteered that as something that was a specific expense of great concern to them, but also a very significant, nearly 2 in 5, talking about the price of food and groceries. Not surprisingly to anyone who's been driving around and sees the signs on every corner advertising gas prices, but 30% also volunteering fuel, gas, oil, something akin to that in terms of transportation costs. But really a range of different levels of expensive, but most of it focused on basically some real necessities in terms of shelter and in terms of the cost of food. On the next slide, we also asked them about their general financial situation. This is a question that luckily we've been able to ask over the last 3 years. And we saw a real change just this year. So despite the pandemic, despite lots of disruptions in 2020 and even extending into 2021, we had basically equal numbers of respondents telling us that they were better off as telling us that they were worse off, with about half saying that their financial situation hadn't really changed during that time period. But that changed this year. So we have significantly more, 43% telling us that they're worse off, although still about 1/4 telling us they're better off. So that those that were sort of in this hovering state in the middle there sort of teetered over into the worse off stage from what we had seen in the past. So a real shift over that time. We also asked about how worried they might be about some of those basic necessities. One of those being able to afford enough food to feed themselves and their family. And that's another case where we saw a big increase in those concerned about this, where it had been about 1 in 5 in 2020, moving up just a tick in 2021. We saw a big jump up to 38% now, telling us that they are at least somewhat worried about being able to afford enough food to feed themselves and their family. Now, that did not come evenly. That increase in concern on the next slide was something that really tended to pop more in terms of the year-over-year increase there. While many in the lower income categories, as you can see on the bottom of the slide there, had already been concerned, even in 2021, about being able to afford enough food for their family, the bigger increase came among sort of this middle income group, those making 50 to 100,000 in household income, where we saw 26-point and 19-point increases overall, but even increases in those in the upper income category now. So we're really seeing marked increases across the board and a significant increase among Native American and Indigenous people as well, indicating so up from 1/3 in 2021 to 62% of that ethnicity telling us that they are worried about being able to afford enough food to feed themselves and their family. On a similar topic, we asked them in the last 12 months, have they experienced a number of different issues, but in this case, skipping meals because they couldn't afford enough food. We have 16% now telling us, up from 9% last year, telling us that they had skipped meals in order to, because they couldn't afford food. And again, that one is really income dependent. We're seeing almost 2 in 5 in the lowest income category telling us that they'd skip meals. That drops down substantially as we move into upper income categories, but it's really, again, Native American Indigenous populations that are most likely to report having coped in this manner because they couldn't afford food, with 2 in 5 telling us now that they have skipped meals. So really sort of stark and upsetting data in this year's report of this massive increase in those trying to find ways to cope with this increase in food prices. So we wanted to not only document these concerns, but look at some ways that we might be able to affect change in this regard. And we're going to see in a couple of different issue topics, we looked at some policy solutions and asked people to tell us how effective they were. So not did you support or oppose that, but really, how would that help Coloradans, in this case, make ends meet? And so we asked about 4 different potential policy solutions and asked them to tell us whether that was very effective, somewhat effective, or did they think that was not too effective as a way to help Coloradans make ends meet. A couple really stand out. Again, a majority said that they thought all of these would be at least somewhat effective. The top one, changing government regulations to reduce the cost of household expenses like food, healthcare, and utilities. We saw nearly 3/4 of Coloradans say that that would be very or somewhat effective in helping Coloradans make ends meet. A couple of other different ideas was raising taxes on the highest income categories to cover some services like housing, healthcare, and education. And for that one, 3 and 5 saw that as at least very or somewhat effective. And then requiring employers to increase pay and benefits for lower and middle income workers. We had a solid majority, nearly 3 and 5, saying that that would be at least somewhat effective, or making government investments to stimulate the economy and create better jobs in communities that are struggling, was something that was also fairly well embraced. Now, not shockingly, there were some partisan distinctions on a few of these being more dramatic than others. And so we've handily showed you the difference between Democrats and Republicans in the last column there in terms of how widely these were embraced across party lines. We saw the biggest distinction, not shockingly, for when we talk about raising taxes, especially on, even though that was the highest income Coloradans, we saw a 53-point gap, and requiring employers to increase pay and benefits for low and middle income workers. We saw a 44-point gap there. But generally, these were embraced by a majority of Democrats and independents, with varying degrees of Republicans saying that they would be at least somewhat effective. So I'll hand it back to Dave to talk about jobs and the Great Resignation.
So as we see concern about the cost of living, obviously part of that is people's sense about whether they're going to be able to earn enough money in order to afford cost of living that they see going up. And so we looked at that a couple of different ways in the survey. One of them is just people's broad level of concern about jobs and the economy overall. And here you'll see some demographic distinctions between people's overall level of concern about the condition of the economy. It is fair to say that this is not as acute for them as their concern about the cost of living. It's much more the lens through which they view their personal expenses that seems to be on their mind, as opposed to what they see sort of going on statewide. And that's reflected in the fact that for many groups, we've seen a decline in their concern about the economy over the course of the last 2 years. The reason for that, obviously, is at the time of our 2020 survey was just after the start of the pandemic. And so its economic impacts were still more uncertain. And so the acute concern that we saw from many subgroups at that point has diminished somewhat here in 2022. It's not entirely uniform, however. You'll see that there is more concern in the Eastern Plains, for example, in this year's survey than what we saw in 2020. Another metric for evaluating the economy, rather than people's perceptions of how it's going statewide, is their expectations for their own employment over the course of the coming year. We asked people in last year's survey and this year's to tell us both if they plan to be employed over the coming year, and then how worried they were that they might not be employed over that period. So a couple of noteworthy shifts since last year in that regard. First, if you look at the black bars toward the right-hand side of the slide, that's the proportion who told us that they did not plan on being employed over the course of the coming year. And that was almost 1/4 of Coloradans last year, reflecting, I think, the fact that with concerns about the virus, there may have been people that were choosing not to participate in the labor force. Obviously, economic supports available at that time to help accommodate people who found themselves in that position. And that is much less the case this year, whether it's because of diminished concerns about COVID or increased economic need. Fewer than 1 in 10 now tell us they don't intend to be employed over the course of the coming year. Among that larger group that plan to be employed, however, we are seeing a greater proportion who tell us they are worried that they might not be able to find employment. In fact, 1/4 of Coloradans tell us that they want a job, but are worried that they might not have one over the course of the coming year. We also wanted to understand the experiences that Coloradans had in terms of increased or reduced economic opportunity relating to their employment. And so we asked them to tell us whether they had experienced any of the following things that you see running down the left-hand side of this slide over the course of the last year. A lot of what you see here reflects the fact that the labor force is somewhat restless and looking for change. You'll see 36%, more than a third of those polled, told us they had actively looked for a different job over the course of the past year. And more than 1 in 10, 12%, decided to leave their job without having found another one to replace it. We also had a significant share of Coloradans, again, more than a third, who told us they had taken time away from work to care for a child, family member, or themselves. So collectively, you'll see a lot of people moving in and out of the workforce and a lot of people who are looking to change or improve their status. We also saw that many had been successful in that regard. A total of 37%, almost 2 in 5 Coloradans, told us that they had received a pay raise or promotion over the course of the previous year. These experiences, however, were not equally shared by all segments of the population. As you'll see, Native American and Indigenous Coloradans in particular were less likely than others to report having received a pay raise or a promotion, and more likely to say that they had had their work hours cut back or their wages reduced. That was one of the starker differences that we saw here by racial and ethnic groups. There are also, as one might expect, some socioeconomic differences in the employment experiences that Coloradans have had. Somewhat strikingly, if you look at that top item on this slide, the proportion who received a pay raise or promotion, you will note that it is those Coloradans who are already best off financially who most reap the rewards of advancement in their careers. Fully half of those in households with 6-figure incomes indicated they had received a pay raise or promotion. That is well over triple the proportion that had that experience among households with incomes under $30,000 a year, where it was only 13%. Conversely, it is those Coloradans in the lowest income households who were far more likely to have actively looked for a different job, had their work hours cut back, their wages reduced, decided to leave their job without finding another one, and also more likely to have been laid off. This aligns with findings that we have seen in prior year surveys where, as Lori sort of alluded to a few moments ago, those who were already on the highest end of the income scale were most likely to say that their financial position had improved in prior years, whereas those on the lowest end of the income scale were most likely to say that they were worse off financially. These kinds of experiences that are not shared across income levels, I think, explain the genesis of some of those different experiences. Another factor that plays in is unfair treatment along lines of race and ethnicity. And as you'll see here, almost a quarter of Coloradans, 24%, told us that either they or someone they knew had been treated unfairly in seeking employment. And that experience, not surprisingly, was more concentrated among Coloradans of color, at 32% having had that experience, than among white Coloradans. And once again, Native American and Indigenous Coloradans, as well as those who identify as multiracial, were more likely to indicate that they had had that experience or had a friend or someone close to them who had of being treated unfairly in seeking employment. Now, of course, one of the big components, as we saw before, of cost of living concerns has to do with the cost of housing. And I'll hand it back to Lori to talk about some of what we learned in that area.
Okay, so when we asked people, you'll remember what was their biggest concern about the cost of living. They told us housing, being able to afford rent or their mortgage. And so we asked them how worried they might be that they would lose their home because they can't afford their monthly rent or mortgage. So again, during the pandemic, this was something, I guess we're still in the pandemic, but you know what I mean. Over the last 2 years, we asked them about their worry about that. It was about 1 in 5 that was telling us that they were concerned about losing their home because of not being able to afford that rent or mortgage. That has jumped up again, just like we talked about before. This one has jumped up too, up to 30% that are now telling us they are very worried, or at least somewhat worried about this, with about 1 in 10 telling us that they are very worried about losing their home. Again, that concern level is not even across all different subgroups of the population. It is most notable among those in lower income categories. So we have the vast majority of those in the lowest income category of less than $30,000 a year in household income are telling us that they are concerned about this. It's nearly half in the next income category, but really even 15% of those in the highest income category are now expressing concern or worry about being that they might lose their home because they can't afford their monthly rent or mortgage. And while there's some fairly predictable geographic distinctions, with the Front Range being the most likely to express that concern, it's still 1/4 on the Western Slope and 18% of those on the Eastern Plains that are telling us about that, telling us that they are concerned. Because of this worry, many people are undertaking basically some coping mechanisms in order to be able to afford their rent or mortgage each month. So on the next slide, you can see that we have about 1 in 3 that are telling us that they're working multiple jobs or working more hours than they want to. Among renters, many are avoiding asking their landlord to address problems. They don't want to sort of stick their heads up and risk having their rent increase or being evicted. And nearly 1 in 3 again are telling us they're cutting back on or going without other needs, like basic needs like food or healthcare. But even 1 in 4 are telling us they've stayed in housing that isn't right for them because they felt like they couldn't afford a new place, or even living with a roommate or friend or family member's home that they'd rather not have to. You can see that renters on the next slide are far more likely to tell us that they're engaging in many of these coping mechanisms, particularly staying in housing that may not be right for them, or cutting back on other needs, or working multiple jobs. So just a lot of different tactics that are being employed by renters in order to be able to afford this. And similarly, this is more likely to affect those in the lowest income categories, once again, where we have a majority of folks in the lowest income category that are telling us they're cutting back on basic needs like food or healthcare. And this really sort of, almost all of these decline gradually up to the highest income category, but lots and lots of folks just really having to engage in a number of tactics in order to be able to afford rent or their mortgage. On the next slide, we asked them to tell us, much as Dave talked about in terms of employment, whether they felt like they or someone they know had been treated unfairly when trying to rent or purchase a place to live. And we had just over 1 in 5, 22% telling us that they or someone they know had experienced that. Again, far higher among people of color in terms of Black and African Americans at 36%, Hispanics at 33%, our Native American Indigenous population at 55%. But even 19% of white respondents told us they or someone they know have been treated unfairly when trying to rent or purchase a place to live as a result of their race or ethnicity. So a significant proportion there. On the next slide, we asked about some tactics, some different policy solutions that might be able to make housing more affordable. Obviously, this is not an exhaustive list. There could be many, many more, but asked them to tell us how effective they thought each one of these would be as a way to make housing more affordable here in Colorado. 3/4 felt that ensuring landlords can't raise rents on current tenants too quickly was something that would be effective, with 2 in 5 telling us it'd be very effective. Requiring developers to build housing for people with lower income levels, about 7 in 10 telling us that they felt that would be very or somewhat effective. And then reducing government regulations to speed up the building of new housing was something that a majority thought would be very or somewhat effective. Interestingly, it's the latter one that actually really bridged across partisan divisions. On the next slide, we saw that Republicans were just as likely to view that one as being effective as were Democrats. We saw more of a partisan distinction when it came to requirements on either developers on what they could build, or landlords on how they could raise rents. So some noticeable distinctions. Another area where cost came to play was in the realm of healthcare, and I'll pass it back to Dave to talk about that.
So healthcare is an issue that we've explored thoroughly in prior year surveys, and we've seen that the cost of healthcare has been a significant concern for Coloradans, even outside of the context of recent inflation. And there has also been significant concern, which significantly increased in this year's survey, that Coloradans might have to go without health insurance coverage. In prior years, both in 2020 and 2021, we saw just over 1/4 of Coloradans expressing this concern, that they or someone in their household might be without health insurance coverage in the coming year. That number jumped up 10 points this year to 37% of those polled. So even as concerns about the pandemic have decreased, concerns about health insurance coverage are on the rise. And as was the case with a lot of the housing data that Lori just walked through, these concerns are not equally shared across socioeconomic groups within the Colorado population. A majority of those with household incomes under $30,000 per year are worried about going without health insurance during the coming year. It is also the case that immigrants and those who speak a language other than English at home are significantly more likely than other Coloradans to be worried about going without insurance coverage. It is not solely these groups that feel this anxiety. I would note that even among the most affluent Coloradans, those with incomes over $100,000 per year, nearly 1/4 are also worried about having to go without health insurance coverage. Once again, the access to healthcare is impacted by unfair treatment that stems from race and ethnicity. As we saw with housing and employment, there are a significant number of Coloradans, more than 1 in 5 in this case, who say that they or someone they know has been treated unfairly when seeking healthcare services due to their racial or ethnic background. And this is a case where, frankly, all Coloradans of color are expressing heightened frequency of encountering this kind of challenge. That includes Black and African American, Hispanic and Latino, Native American and Indigenous, multiracial, and all Coloradans of color as a group, about 10 points more likely than white Coloradans to say that they or someone they know has had that experience. These concerns about the cost of living have also already impacted the access that Coloradans have had to healthcare services. We asked people both in 2021 and in 2022 to indicate whether they had postponed medical or dental care. And the proportion went up this year by 6 points from 39% to 45%. Now, obviously, there are many different reasons that people might put off going to see a doctor or dentist. Certainly during the course of the pandemic, for folks who were concerned that their health might be vulnerable and were trying to avoid contact with people outside their households, that certainly could have played a role. But concerns about cost may as well, and especially in the last year when we've seen concern about the pandemic declining so sharply and concern about the economy increasing so dramatically and the cost of living. This increase probably is more likely associated to some of those cost concerns than it is to concerns about health and exposure. But there's a range of other factors that might come into play that would lead Coloradans to make a decision to defer getting health care. Lack of insurance certainly is one. People who either are uninsured today or worried about losing their health insurance were significantly more likely in the survey to say that they had postponed getting medical or dental care. Those who were in that roughly 1 in 5 Coloradans who said that they or someone they knew had experienced unfair treatment on the basis of race when seeking healthcare were also more likely to say that they had deferred care. And then as a sign that the sort of financial instability and cost of living concerns that are so prevalent may have played a role. 78% of those who had skipped meals because they couldn't afford food also told us that they had postponed medical or dental care. Again, not a direct correlation, but a pretty significant indicator that these cost concerns are leading Coloradans to make a variety of choices they would rather not make because they simply are worried that their financial resources are stretched too thin. There are also a number of other groups that indicated that they had deferred medical or dental care over the course of the last year that are worth highlighting. Those who identify as LGBTQ were more than 10 points more likely than those who do not to have said they had deferred medical or dental care. Those who live with a disability, 22 points more likely than those who do not live with a disability to say that they had deferred care. And then, as referenced on the prior slide, 65% of those who were uninsured had indicated that they had deferred care, more likely than those who were insured publicly or privately to have done so. We've made reference several times to the decline in concern about COVID-19. We did still have a couple questions in the survey just to sort of probe people's feelings on that issue a little bit more, and I'll hand it back to Lori for those.
Great, thank you. So one of the things that we asked about this time, and we've had to sort of keep changing our terminology in order to capture the latest and so-called greatest on the spread of COVID-19 during this time, was to ask about the spread of new variants and to ask people to tell us how big a problem they perceive that to be here in Colorado. Again, extremely serious, very serious, somewhat serious, or not too serious a problem. We had 1 in 4 basically tell us that they thought of that as an extremely or very serious problem, with another quarter telling us it was somewhat serious. So about half and half in terms of the level of a concern. That intensity of concern was, again, fairly broad-based, but it was somewhat higher among people of color, where we had 1 in 3 telling us that they felt the spread of these new variants was an extremely or very serious problem, versus about 1 in 5 white respondents. So some distinction there, a little bit higher as well among lower income households in terms of that level of concern. We also asked about how confident they were moving forward that Colorado was well prepared to minimize both the health and economic impacts of another pandemic in the future. And we saw, again, respondents somewhat split here, about 53% telling us they were at least somewhat confident, although fairly small number, only 14% saying, expressing that they are very confident we're prepared to handle another pandemic. And about 2 in 5 telling us they're simply not confident. There are some notable distinctions here. Republicans were more divided, confident and not confident on how well prepared we are. It was a bare majority of unaffiliated respondents or independent respondents telling us that they're at least somewhat confident. The vast majority of Democrats were more likely to express that they are at least somewhat confident that we're well prepared. And then notably, there was an interesting economic distinction as well, with higher income households far more likely to tell us that they thought of that they were confident in our state's ability to handle this versus those in lower income households. So again, having gone through lots of different variations of pandemic questions over the last 3 years, sort of interesting to see where Coloradans are in terms of a crystal ball moving forward. We also asked a number of different questions, and certainly one of the repercussions, or one of the things that people are often connecting to the pandemic, is sort of the mental health impacts. So we asked respondents to tell us this year, on the next slide, thanks, that whether or not they've experienced mental health strain, such as anxiety, depression, loneliness, or stress in the last year, not connecting it to the pandemic, just asking broad-based. And we have 3 in 5 Coloradans, 61% telling us that yes, they've experienced anxiety, depression, loneliness, or stress, or some other mental health strain. And it's notable, some of the subgroups here really stand out. LGBTQ Coloradans, 84% telling us they've experienced mental health strain in the last year. We also saw it higher among younger respondents, particularly those under age 30, and somewhat younger women here, about 4 in 5 telling us they're experiencing that, Native Americans too. And then those living with a disability, the uninsured, those who have insurance through Medicaid, or those in some of the lower income categories are far more apt to tell us that they've experienced some form of mental health strain. But honestly, it was, significant proportions of all Coloradans were telling us that they've experienced some form of mental health strain. over the course of the last year. So clearly, lots of people needing to access mental health care in terms of dealing with some of this mental health strain. And so we asked respondents to tell us on the next slide what challenges they or another family member might have experienced in accessing mental health services. So again, this is among those who've experienced mental health strain only. We're asked these questions. You can see again, I don't think anybody will be shocked at this point in our recitation of the survey findings, the cost was a major impediment for people. 2/3 said that the services were too expensive out of pocket, that was a major, at least minor challenge. But that wasn't the only challenge. Available appointments, or wait to get services was too long. A majority found that to be a major or minor challenge. How to find a provider or not being able to find one, a provider who's understanding of they or their family members' background and experiences was something that stood out to about half of respondents, as well as not feeling comfortable speaking to a stranger about their mental health concerns. Privacy is somewhat lower, but still a significant 2 in 5, saying that was at least a minor challenge, or concerns about being judged by family members, friends, or coworkers. So really a range of everything that we asked about was deemed to be a challenge by a significant proportion of those who had experienced a mental health strain. Notably, among those who are living with a disability, which we called out again as a group that was more likely to be experiencing mental health strain, we saw that a number of different factors were somewhat higher among this population. So having difficulty finding a mental health care provider, or finding a provider that'd be understanding of their background or experiences, or just not feeling comfortable speaking to a stranger about mental health concern. We had a majority of those living with a disability that were likely to tell us that they saw that as a significant challenge, and far more so than those who do not live with a disability. As well, on the next slide, you can see that certainly having health insurance is something that was significant, but again, even those who had had health insurance through their employer, who were self-insured, were very likely to tell us that they were experiencing a range of these challenges. But you can see the uninsured really stand out on a number of these, especially the expense piece of the equation. So lots and lots of data here. Again, we wanted to look at not just let's think about the problem, but let's think about potential solutions. And so when we asked respondents to tell us how effective each of these were some of the most widely embraced of any of the potential policy solutions that we tested. 3/4 or greater telling us that each one of these was something that they felt like could be at least somewhat effective in improving mental health here in Colorado, but clearly creating more options for people to access healthcare where they live, mental health care where they live, and requiring health insurance company to cover more mental health services without requiring copays, given that was one of the top barriers or challenges. We saw a majority saying that they thought that would be very effective in terms of helping improve mental health in our state. On the next slide, you can see that, again, we saw partisan distinctions on many of these policy solutions, more muted on the top two. And then on the second one, on the last one on this column here, pairing mental health professionals with law enforcement to respond to mental health emergency calls. Overall, we had 3/4 telling us that they felt that would be at least somewhat effective, but that one tended to provoke a more partisan response than did some of the other policy solutions that we tested here about accessing healthcare. So I'll hand it back to Dave to talk about some of the last topics that we discussed.
All right. So over the course of the pandemic, we have been interested in understanding how Coloradans view alcohol and drug use, both their own and the issue of alcohol and drug use as a broader public concern, and the ways that that has evolved as pandemic restrictions have led to more social isolation and perhaps affected people's use of alcohol and drugs. In this year's survey, when we asked people whether they had either increased, decreased, or maintained their level of alcohol and drug use, you'll see that a majority said that they had kept it about the same, but twice as many told us they had decreased it as said that they had increased it. And again, that may reflect the fact that during 2020 and 2021, the sort of isolation and limitation on people's social activities may have meant that their baseline of alcohol and drug use was a little bit higher, and then it declined. But we do at the same time see that more than 1 in 10 Coloradans tell us that in the past year, they have felt worried about the amount of alcohol and drugs that they consume. And you'll see on the right-hand side that those who feel this concern about their alcohol and drug use are disproportionately younger, under age 40, disproportionately LGBTQ Coloradans, those who are either Black or African American, Asian and Pacific Islanders, or Native American and Indigenous, as well as those who live with a disability. As with many of the other issues that Lori has described, we wanted to understand how Coloradans felt about policy interventions that might help people who are struggling with alcohol and drug use, and ask them to rate the effectiveness of a variety of steps that the state could take. As you'll see here, there was a pretty broad consensus that a wide range of approaches might have some merit, with at least 2/3 of voters viewing all 4 of the items that we tested as being effective approaches. The strongest feeling came for the item at the top of the slide, making treatment for addiction more affordable and easily available. I think many of the same barriers that Lori described, people seeing to getting mental health treatment, apply to getting treatment for substance use disorders. And so expanding that availability, Coloradans widely view as an effective approach. The second ranked one on the list is connecting people trying to recover from addiction with support from other people like them. That model of sort of bringing people together who are facing some of the same struggles to help each other through it, more than 4 in 5 Coloradans view as an effective approach. We did see some differentiation in views of the last item that you'll see on this slide, sending people to treatment, not to jails or prisons, if they have committed a crime related to alcohol or drug use. While overall, 67% of Coloradans view that as an effective approach, it was the one policy sort of avenue that we tested here where we did see a sizable partisan difference. 85% of Democrats view this as an effective approach compared to just 46% of Republicans, almost a 2-to-1 gap between the two parties. I will note, though, that even among Republicans, almost half view this shift from punishment to treatment as being an effective way to handle alcohol and drug use. Our final set of questions dealt with crime and policing. And as you'll recall at the very beginning of the presentation, when we were looking at the range of issues about which Coloradans are concerned, we noted that crime was one of the places where we had seen the biggest year-to-year increase in the concern that Coloradans express. 41% rated crime a very serious problem in last year's survey, and that vaulted up to 57% in this year's survey. There are some notable differences in the degree of concern that Coloradans express. Again, partisanship is a notable one. 3/4 of Republicans view crime as a very serious problem compared to just 48% of Democrats. The differences across lines of ethnicity and income, in contrast, are relatively more modest, with relatively consistent levels of concern across each of those demographic dimensions. And nothing like the starker divide that we see across partisan lines. On the issue of public safety, we also broke out the level of concern about crime by a couple of other demographic groups. And you can see here the year-to-year increase, which was so stark for the population as a whole, does not necessarily apply uniformly across the state, although the level of concern is up in most subgroups of the population. Among Native American and Indigenous Coloradans, for example, it actually declined by 7 points. Given the size of the subgroup, that difference is right around the survey's margin of error, so it's more a question of holding steady. But concern increased more among white Coloradans than it did among Coloradans of color. And then you'll see that geographically here, concern increased less in the Larimer and Weld County region of the state than it did in most of the other locations, although no real dramatic difference between the Denver metro area, El Paso County, and then some of the more rural areas of the state in terms of the increase in concern about crime. The second aspect of public safety that we wanted to take a closer look at was police violence and misconduct. About 3 in 10 Coloradans view that as being a very serious problem today, ranking it relatively low on the list of concerns that we tested statewide. Not a dramatic difference from where that level of concern has been in prior years, but there are some pretty notable differences here across demographic lines. Again, a partisan difference with Democrats expressing almost 4 times the level of concern that Republicans do, 47% and 12% respectively, rating it a very serious problem. LGBTQ Coloradans are twice as concerned about police violence and misconduct as are those who do not identify as LGBTQ, and significantly higher concern within the Black and African American community and the Native American and Indigenous communities. In each case, in excess of 2/3 of those polled rated police violence and misconduct a very serious problem, while it is much lower for Coloradans of other racial and ethnic backgrounds. And here again, you can see some of the shifts in concern that we have seen over the course of the last few years. It is notable that while concern has decreased modestly from 2020 to 2022 for a range of racial and ethnic groups, it has actually gone up for Black Coloradans from 63% expressing concern in 2020. And obviously our initial survey was conducted during that summer when protests around the murder of George Floyd were occupying a lot of public attention. Concern has just gone up since that point among Black Coloradans, even if it has declined slightly among Coloradans of other racial and ethnic backgrounds. Finally, we also asked respondents to tell us whether they or someone they knew had experienced unfair treatment when interacting with law enforcement. 29% told us they had. It was one of the areas where we saw the broadest experience of unfair treatment on the basis of race or ethnicity. And not surprisingly, it is Black and African American and Native American and Indigenous Coloradans that are most likely to report having experienced this unfair treatment, which aligns with the significantly higher levels of concern they express about police violence and misconduct as well, suggesting that a lot of that is rooted in their own experience or the experience of others that they are close to. So that is a whole lot of data that we've shared with you over the course of the last nearly 1 hour. And I know that there are likely lots of questions to sort of dig into. Before we do that, I'm going to hand it back to Jace, who's going to talk a little bit about ways that this data is available to you and how to dig into it, and then we'll take on your questions.
Thanks, Dave. Thanks, Laura. You can stop sharing your screen, Dave, and take a breath. And Kyle, you can go ahead and queue up the Pulse website. So if you're feeling overwhelmed by the data, totally hear that. And we recognize that it's hard to digest all of this all at once in an hour when it's all being thrown at you. So we work as hard as we can to make this available. So we have a website devoted exclusively to Pulse. And the easiest way to get to the data is to click on results. And when you click on results, there are a number of ways this year that you can take a look. First, I'll draw your attention to the choose your year. Kyle is scrolling very fast, but above, it lets you choose your year if you want to go back to the past versus this year. To access this year's findings, Kyle, go ahead and scroll down. You can download the slide deck, which we call Key Insights, presentation of the full results. The slide deck we just looked at, click there, download, dig in as you see fit. You can also download our shorthand, as we call it, the top line. It's all of the questions, the full questionnaire, and how all Coloradans responded. So it's in this pretty easy to digest format, and you can look and see specifically what percentage of the population identifies, or excuse me, what percentage of our respondents identified as Chinese or Filipino, and you can look at the top line or the overall, how the overall respondents answered each question. We also have made the crosstabs available. This is for nerds and geeks like me who want to look at how different subgroups answer each question. This takes a lot of time and creates a lot of eye pain. So we are in the process right now of making these crosstabs more available through an interactive data dashboard that should launch by the end of this week. But if you're up for the pain and the loss of vision associated, you can look at how all the different groups from age, ethnicity, gender, type of insurance coverage, how they answered all the questions that we asked. Then finally, we'll also make available a report that we should hopefully have by the end of the week or early next week if you like to read narrative style. And then finally, the briefing, a recording of this briefing. So many ways, some available now, some that are coming in the coming days of what you can look at. And as I said earlier, we did release in phases. So we've got a lot of these resources broken out by phases that are still available for you. So the story here is, you can dig deep as you want into this data, and we really value making it as transparent as we can for folks who do want to dig in. I see Kyle navigating now to our partner toolkit. If you love this data and you want to share it, we would love that. So we've created some toolkits that allow you to share. We've got graphics, sample language that you can use in both English and Spanish to help you share the data with your supporters on Facebook or with policymakers you're sitting down with and beyond. So you can dig in. That's the story. Thank you, Kyle. Very nice impersonation of Vanna White. Now let's do some questions. And they were being cultivated by some of my friends on the line here. So I'm just going to start with Tamara's question here. Across the poll, is it typical to see people focused more on specific topics that may be part of a larger issue than on those larger overarching topics? So the example here is like wildfires versus climate change, wildfires being more specific, climate change being broader, cost of housing versus cost of living, gun violence versus crime. So I think this is specifically a question on the open ends and how people are lifting up their concerns on the open end. Are they more likely to get specific or keep it kind of general? I think that's what Tamara is getting at. Tamara, feel free to weigh in on the chat and tell me if I've misinterpreted your question.
Ooh.
I would say it's a little of both. If you read through the things that people describe, there will be some who are very general in talking about their concerns and some that are incredibly specific. I mean, we will have people who are complaining about, specific public safety concerns that are going on in their neighborhood, or, a specific fire event that they feel like wasn't handled very well. But then there will be those who will just be talking in much broader terms. And that's part of the reason we ask those open-ended questions as well as the closed-ended questions, so we can hear how people are articulating these issues in their own voices, at the same time that we give people standardized descriptions of issues and ask them to rate their concern with each one.
Yeah, and just to be clear, when we show those proportions on the open-ended questions, we've sort of read through all of those and categorized them. So that's why you're going to see a more general category, but that's why we're also showing you those examples of what people said.
Great question, Tamara. Thank you. Phyllis at the Colorado Safety Net Collaborative is asking about people on Medicaid. So if you were watching the chat, you probably saw that we can look at how people on Medicaid looked at every single question. So that is in the crosstabs and easy to do. But there's sort of a policy challenge that's happening that we didn't quite get at in the poll, but there's a freeze on Medicaid eligibility. So because Medicaid has had to keep people on the rolls, even if they're technically no longer eligible, right? Like right now, because of the public health emergency, you can't be kicked off. Did that come into play here? Did it create some sort of artificial level of security for healthcare? When we pulled the data, we did see that Medicaid folks are more likely to worry about losing their insurance. I think we can only guess, right? I mean, if that's because of the public health emergency or because something else going on. But I just wanted to give you a chance, and other research that you've done, is it pretty common to see people who are on Medicaid worried about losing Medicaid access?
I would say yes, it is. Obviously, people who are on Medicaid are often in, the most likely to be financially vulnerable and facing precarious circumstances, not just with maintaining their health care, but with juggling all the other aspects of the cost of living that we're talking about. And people's eligibility, they may know that there was sort of a safe harbor that was created around the time of the pandemic, but I think their experience is such that these kinds of things are rarely permanent. And so that sense of instability, I think, is, from the data I've seen, sort of a constant for folks who are on Medicaid. So it'll be something that I think, we can look at next year's survey when we're sort of out of this period of time a little bit more thoroughly and see how those numbers evolve.
Phyllis, I hope I did justice to your question there. From Adams County Commissioner Emma Pinter. I live in Adams County. Thanks for being here, Commissioner. Question, did you do any research on how reducing government regulations to increase the speed of housing developments interacts with Coloradans' current anti-growth or NIMBY sentiments? I'll take this one because the answer is no. We did an impulse. Lori, you're laughing, which makes me think, man, you've got something to say here.
Well, it's sort of this it's sort of this tension we have had and it ebbs and flows in Colorado, from mountain communities to the Front Range, in terms of people being concerned about growth, but then affordability of housing at the same time. So, it's just such a tight wire that unfortunately elected officials like the commissioner are having to walk at all times in terms of that concern. I would say a lot of that relates to type of housing and just general change. So concerns about growth are not just limited to seeing more stuff being built necessarily. It's just, number of people in the mountains. We hear lots of complaints about number of tourists or second homeowners. So, it really can vary region to region, but this has been sort of one of the consistencies we've seen in data going back the entire time I've lived and polled here in terms of concerns for Coloradans. Obviously, acutely so right now in terms of affordability.
Yeah, and Lori, I think one of the stories of those housing policies is that we had pretty high level belief in effectiveness across all of them, which says to me this sort of understanding that we all have a role to play. It wasn't just government. It was also developers. It was also landlords. The other piece that I'll just share with you, Commissioner, and others, is that we have explored housing and growth issues in some qualitative research, because we know even when policymakers and Lori were, talked about this, they want to take action and they want to do the right thing and they want to make progress on this issue, but it can be really difficult when you have a public who is very upset about congestion on the trails, congestion at the grocery store, traffic, and so we have been exploring the mindsets of Coloradans and how we communicate about housing more effectively in order to improve the likelihood that policies like this are put forth and actually put in place. So hope that's helpful. Thank you, Lori. Back to my list of questions here. Given the Colorado Health Foundation's focus on health and health equity, what repercussions on health are anticipated in light of the data? So I'm not sure I want to sort of unpack this as best I see it, but this comment came up in relation to our mental health data, but we certainly may not be tied to that. My sense, I'll just say that we do a survey like this in order to improve the health of Coloradans by hopefully advancing good policy. We look very closely at the inequities. You saw Dave and Lori lift up data around race, data around income, that helps us understand for whom is health furthest from reach. And we make all this data available so that advocates and policymakers and business leaders and other decision makers can use it to make better decisions. I hope that gives you a sense, Tamara, of the repercussions that we're hoping to have, which is to say, we hope good policy is made, using this data. Lori and Dave, you're welcome to chime in further if you've got additions here. Kat, you had a similar question. How widely are these findings shared? As widely as they can. I'll talk to anybody who asks. And so if you're sitting here listening and thinking, it would be really, really great to put these findings in front of this board I sit on or this organization, please do be in touch. Those are opportunities that we try very hard to say yes to. We do want to share as best we can with decision leaders in the state. Okay, next question. Has there been an attempt to correlate people's responses to media representation or to type or source of media coverage?
Well, the answer is no, in part because, well, how do I say this nicely? People are not always entirely accurate, and our media is so diffuse now that people are getting it. I mean, people are honestly bombarded with information from lots of different sources. And so, even in qualitative research, like focus groups and things, when we're trying to say, well, where specifically did you see, read, or hear about this particular thing? Sometimes people have a really hard time reporting that back. And I will say too, that obviously it's a little bit of a chicken and an egg, right? The media is trying to represent what people are concerned about and report on that. And then people can become more heightened and concerned if they're hearing a lot about something. So I can't say that we know that. That's one of the more difficult things at times to unpack, really, especially today, given just how many sources of information and how diffuse that is.
Great. Thank you, Lori. I think we have time for one or two more questions here. So Colorado Foundation for Universal Healthcare is asking about message testing with Coloradans. I'm happy to chime in on this one and say, we don't test messaging in Pulse. We do put policies in front of people and get a sense of how they feel, whether they think those sorts of policies would be effective at solving the problem. We do other research work that explores messaging and how we can effectively communicate, more persuasively communicate about issues like housing, like mental health. And we are still actively doing that. And while I always wish I had answers to how to be a more persuasive communicator, that process takes quite a bit of time for us to figure it out. So stand by. We will ultimately share those with partners who are communicating on these issues, but Pulse is not a format where we do message testing. Hope that is a helpful answer. Dave, I hope you still have the slide deck up. And if so, could you bring the map of Colorado back up so folks can see and just talk through how we divide folks into regions? Sorry, I guess I should say, Dave, will you talk about how we divide?
Yeah, sorry, I was actually just pulling up the slide, but it looks like you beat me to it.
Oh, look at that. Oh, Kyle just did it quick. Thanks, Kyle.
So, this slide shows how we segment people by population. What we're trying to do here is keep a balance between where the numbers are there's a large enough population that we have a large enough subsample to say something meaningful about, and then the obvious differences that we know are present by the different circumstances that people who live in more and less highly urbanized areas face, as well as those who live in the eastern and western parts of the state. The key point to understand, though, and I think if I recall the question in the chat, it was about southern Colorado. The survey itself is a random and representative sample of adults throughout the state, which means each geographic region of the state is represented in its proportion to the overall population. In some cases where we know there is a smaller geographic subgroup that is of interest, like Pueblo County, we conduct extra interviews there to boost our sample size and give us more confidence in what we can say about what local residents think. There is no area of the state that is omitted, and every area of the state is included in at least its proportionate share of the overall Colorado population.
Beautifully done, Dave. That was much better than whatever I would have pulled together. I think we've gone through most of our questions here. So I think I'm going to close us out by offering even more appreciation for those of you who spent 90 minutes with us digging into this data, and invite you to dig in further. On the website, we showed you different resources to download. We also have blog posts of how we've kind of characterized the data and the storylines that we've pulled up. A lot of it you've heard here today, but just another format that we make to help you understand what we're seeing and to invite your insights as well. I would love my colleagues, if you would put my email address in the chat. If folks want to get in touch with us with questions about the data, or you need help seeing how people on Medicaid responded, or you want us to come and present to a group of X, Y, or Z, start with me. I may send you to smarter people, but start with me, and we'll figure out how we can get this data to more people and hopefully use it to improve the health of all Coloradans. Thank you, Dave. Thank you, Lori, and to my colleagues who are on the chat. Thank you as well. Have a wonderful rest of your day, folks. Take care.